Note: to protect the privacy of the individuals involved, the names of patients in this account have been changed. The pseudonyms we have chosen are used to present their very real stories. The case file for the patient we will call Andrea Duval opens just before 11 o'clock in the morning as she checks in at the front desk of her neurologist's office. She finds a seat on a stiff, faux leather couch in the waiting area, her hands clasped together. A familiar anxiety settles in. She is here, once again, hoping that this appointment will be the one that finally provides an explanation for the chronic, debilitating headaches that have plagued her. To distract herself, she picks up a glossy magazine from the coffee table. On a television mounted in the corner, an old episode of The Price is Right plays softly. But as she waits for her name to be called, the background noise begins to warp. The cheerful bells and whistles of the game show distort, rising in pitch and volume until they become a piercing scream inside her skull. The fluorescent lights overhead intensify, growing so painfully bright she feels as if she's under an interrogation lamp. Desperate for a neutral focal point, Andrea shifts her gaze to a large fern in the corner of the room, hoping the overwhelming sensory input will pass. But instead of relief, she is gripped by a new, utterly unfamiliar sensation. The plant before her seems to pulse, and then to grow. It doubles in size, then triples. Soon, its green fronds seem to monopolize the entire room. The very walls of the office appear to bend and shift, making space for the impossibly giant fern. Andrea darts her eyes to the faces of the other waiting patients. They remain placid, staring blankly at the TV, completely unaware. Is she the only one witnessing this? Is she losing her mind? Then a nurse opens a door. Andrea Duval? As her name is called, the illusion shatters. The plant shrinks instantly back to its normal size. The lights dim. The sounds recede. Andrea is so rattled, so profoundly shaken by the experience, that when she finally sits before her doctor, she fails to mention what just happened. But this episode was not an isolated event. It was just the beginning. For the next 6 years, Andrea's world would periodically and unpredictably transform into a whimsical, distorted fairyland. Rooms would stretch 20 feet higher than normal. Entire houses on the street would appear to shrink, so small she felt she could crush them between her fingers. Trees would seem to shoot off into the distance the closer she got to them. And over time, this fairy tale reality would become her own personal nightmare. She had no idea that she was suffering from a bizarre and deeply misunderstood neurological condition, a disorder known as Alice in Wonderland Syndrome. Welcome to Medical Obscura. In this investigation, we journey down the rabbit hole to explore one of medicine's most surreal conditions, commonly shortened to AIWS and sometimes referred to as Todd syndrome. Patients with this disorder experience startling perceptual illusions which alter the form, the size, and the movement of the objects around them, and even of their own bodies. While there have only been a few hundred officially documented cases, some doctors now estimate that this syndrome actually affects as many as 10 to 20% of the population at some point in their lives. In this episode, we will examine why AIWS is so frequently underreported and so notoriously hard to diagnose. We will explore the syndrome's fascinating historical roots through the life and work of the author Lewis Carroll, who may have been one of its most famous sufferers. And finally, we will search for a scientific explanation for this disorder and see what progress has been made to help those who find their reality suddenly warped. Imagine waking up one morning to find yourself plunged into a surrealist painting. You are living inside a twisted fairy tale, a place where the floor rushes up to meet you and the ceiling recedes into the heavens. People around you might tower 10 feet tall or shrink to the size of dolls. The gentle ticking of a clock could explode in your head like fireworks. While this concept may sound like abstract fantasy, for some, it is a sensation that is terrifyingly real. This was certainly the case for a woman we will refer to as Eleanor. One evening in 2014, Eleanor was tucking her 10-year-old daughter, whom we will call Sophie, into bed. Sophie had often complained of terrible headaches, especially when she was tired, but on this particular night, the young girl offered more specific and deeply unsettling details. She told her mother that everything in her bedroom, her bookshelf, her toys, her desk, was suddenly shrinking and becoming incredibly small. At the same time, she felt her own body expanding, growing uncontrollably large, as if she were a giantess in a doll's house. In that single moment, a floodgate of forgotten memories was thrown open for Eleanor. She was instantly transported back to her own childhood, lying in her own bed, gripped by a headache, trying to explain the exact same, impossible sensation to her own mother. She recalled the distinct feeling that everything in her room looked impossibly far away, as if she were viewing the world through the wrong end of a pair of binoculars. For years, she had kept these bizarre experiences a secret, convinced they were just strange dreams or figments of her imagination. Eventually, the episodes had simply faded away on their own. But now, listening to her daughter describe the same surreal visions with terrifying clarity, she knew it was real. And she was deeply afraid for her child. After Sophie finally fell asleep, Eleanor began a frantic search on the internet. What was this bizarre condition that she had apparently passed down to her daughter? Was it dangerous? And was there anything she could do to stop it? Within minutes of typing the symptoms into a search bar, the answer was clear. Both Eleanor and her young daughter were sufferers of Alice in Wonderland Syndrome. The roots of this peculiar condition, however, run much deeper than the internet, deeper even than the fairy tale itself. In fact, a growing body of evidence suggests that the story of Alice's journey through Wonderland was not merely a work of fiction, but was instead directly inspired by the author's own real-life experiences with this very disorder. His name was Charles Lutwidge Dodgson, an English academic born in 1832, though the world would come to know him by his pen name, Lewis Carroll. Carroll was a brilliant mathematician and logistic, but he was also painfully shy, a trait exacerbated by a severe stammer that plagued him for most of his life. Perhaps because of this, he often found more comfort in the company of children than in that of his adult peers. While working as a tutor at Oxford University, he became a close friend of the campus dean, Henry Liddell, and was like a beloved uncle to his 3 young daughters, Lorena, Edith, and Alice. Carroll delighted in entertaining the girls with magic tricks, poems, and fantastical stories. During one legendary picnic on a summer afternoon, he improvised the tale of a curious young girl who stumbles into a surreal, dreamlike world populated by outlandish characters. The middle sister, a 7-year-old Alice, was so utterly enthralled by the story that Carroll, in a moment of affection, named the heroine after her. She begged him to write it all down. He did, and in 1865, Alice's Adventures in Wonderland was released to worldwide critical acclaim. But like so many great artists, it is believed that Carroll's incredible creativity was inspired, at least in part, by his private suffering. Throughout his rise to fame, he kept a series of detailed personal diaries. These accounts reveal his lifelong struggle with what he called bilious headaches, severe, crippling migraines, often accompanied by vomiting. Even more significantly, he documented his experiences with powerful visual auras or ocular disturbances. In one entry, Carroll described an episode with clinical precision, writing that it began with a distinct loss of a large piece of the area of vision in the left eye. These journals provide the first window into Carroll's hidden torment and the strongest clue that the surreal world he famously created was one he may have unwillingly visited himself. Modern neurologists, rereading Carroll's work through a clinical lens, have come to a startling conclusion. Some of the most critical clues to his condition were not hidden at all. They were described in plain sight on the pages of his most famous book. One of the most iconic moments in the story appears early, in Chapter 2. Alice discovers a small bottle with a paper label tied around its neck, bearing the words, "Drink me." After she consumes the mysterious beverage, she shrinks down to the size of a bowling pin, the room around her becoming cavernous and immense. This scene, researchers now believe, may be Carroll's own way of describing a classic symptom known as macropsia, a perceptual distortion where objects in the external world appear gigantic, while the sufferer perceives their own body as shrinking and becoming smaller. Carroll's writing also seems to demonstrate another common symptom of AIWS. His book depicts micropsia, the opposite sensation, where external objects appear to grow much smaller, and the subject feels as if their own body is expanding to giant proportions. Shortly after shrinking, Alice consumes a small cake that causes her to grow so large that her head scrapes the ceiling of the hall. The book is filled with these clinically precise descriptions. Alice also exemplifies symptoms of teleopsia, where objects appear to be much farther away than they actually are. Researchers believe Carroll was describing this when he wrote, "Curiouser and curiouser," cried Alice. "Now I'm opening out like the largest telescope that ever was. Goodbye, feet." The opposite sensation, palopsia, where distant objects appear unnervingly close, is also a feature of the syndrome. Carroll may have even used Alice to illustrate his own experiences with depersonalization, another common and deeply unsettling symptom. Those who experience depersonalization often feel as if they are observing themselves from outside their own body, a sense that their identity, thoughts, and feelings are unreal or do not belong to them. In Chapter 2, a confused Alice muses, "I almost think I can remember feeling a little different. But if I'm not the same, the next question is, who in the world am I?" Based on these rich and detailed passages, many researchers now believe that the character of Alice was a surrogate for Carroll's own neurological symptoms, a brilliant, fictionalized way for the author to process and document what he was experiencing in real life. And Carroll was likely not the only famous artist to suffer from these mysterious visions. Over a century earlier, in 1726, the author Jonathan Swift seemed to demonstrate symptoms of AIWS in his classic novel Gulliver's Travels. In Swift's book, Gulliver encounters the tiny, 6-inch-tall inhabitants of Lilliput, and later the 70-foot-tall giants of Brobdingnag, a perfect literary parallel to micropsia and macropsia. In the 19th century, the celebrated German painter Kathy Kollwitz also documented her experiences with what appeared to be Alice in Wonderland Syndrome. Her personal journals are full of entries about objects that would inexplicably grow larger or smaller right before her eyes. Art historians believe this perceptual disorder is what caused Kollwitz's artistic style to pivot away from realism towards the emotional intensity of expressionism. The subjects in her powerful artwork often feature disproportionately large heads and hands, which may have been her way of articulating the syndrome on canvas. It's unclear if artists like Kollwitz or Swift ever sought medical advice for their conditions, but the chances were slim. Disorders that seemed linked to mental health were simply not taken seriously until the 20th century. In Carroll's day, no one wanted to be pegged as someone who was potentially losing their mind. Carroll, however, did see a doctor. According to his journal, in 1856, he consulted an ophthalmologist about his strange visions. The eye specialist, unable to find a cause, told him there was nothing he could do. He offered only simple advice. Avoid reading for long periods, especially on a moving train, and choose books with a larger typeface. It seems the doctor believed Carroll's condition was nothing more than simple eye strain. Unfortunately, Lewis Carroll died in 1898, never knowing the true root cause of his lifelong affliction. In fact, it would be another 50 years before a physician would finally begin to piece the puzzle of the syndrome together. In 1952, an American neurologist named Caro W. Lippmann, after observing a pattern in his patients, believed he had found the answer. He theorized that each of these strange cases was tied to something millions of people were all too familiar with: crippling migraine headaches. But as we will see, this important revelation was just the tip of the iceberg. In 1952, the neurologist Caro W. Lippmann began documenting a series of bizarre cases. While his patients all suffered from severe headaches, they also reported strange, fleeting symptoms that he had never encountered. His first case was a 38-year-old woman, whom we will call Clara. She mentioned to Dr. Lippmann that just before a recent migraine attack, she had the distinct and terrifying sensation that her neck had suddenly grown over a foot in length. She also described, during her headaches, a feeling of shrinking down to only a foot in height, while the furniture in the room towered over her like skyscrapers. Lippmann's second patient, a 23-year-old woman, echoed Clara's testimony. She claimed that during her own headaches, her head would feel as if it had ballooned to tremendous proportions, yet it felt so light that it seemed to float up towards the ceiling. Then Lippmann met a third patient, a woman we'll call Martha. Everything began to click into place. Martha explained that she often experienced a feeling of growing short and wide during her migraine attacks. She told Dr. Lippmann it was a Tweedledum or Tweedledee feeling, a clear reference to the iconic characters from Alice's Adventures in Wonderland. Lippmann was one of the first physicians to make this explicit connection between the medical phenomenon and Carroll's novel. He wrote, "I would hesitate to report these hallucinations had not more than 80 years ago a great and famous writer set them down in immortal fiction." Lippmann became convinced that Alice's experiences in the story were telltale signs that Carroll himself had suffered from the same syndrome. After observing nearly a dozen patients, he felt confident in his diagnosis. This strange condition was an exclusive and unusual side effect of migraine headaches. But the migraine-only theory would not prevail for long. In 1955, a British psychiatrist named John Todd published a series of groundbreaking new discoveries. It was Dr. Todd who would give the condition its official, enduring title, Alice in Wonderland Syndrome. He also provided the first detailed and thorough catalog of its wide-ranging symptoms. Some of his patients described a feeling of being split in two, a symptom he termed somatopsychic duality. Others reported that colors would spontaneously change before their eyes, a sensation known as dyschromatopsia. One young girl, for example, claimed that her mother's face would suddenly appear green. Todd's patients also complained about a strange deceleration in time, as if the entire world around them was moving in slow motion. And he documented cases of zoopsia, vivid visual hallucinations of animals, with patients claiming that swarms of birds or insects would suddenly appear and fly around their heads. But Dr. Todd's most important finding was this. Unlike Lippmann's subjects, only some of his AIWS patients actually suffered from migraines. He discovered that the syndrome could also stem from other causes. A 17-year-old female patient with a history of anxiety but no migraines frequently felt her body shrink to half its size. Another client, a 39-year-old woman with panic attacks, claimed her body would grow so large she felt she could fill an entire room. Furthermore, Todd discovered that 2 of his patients had a history of epilepsy, a neurological condition that disrupts the electrical connections between neurons. Later case studies would confirm this link, documenting patients who experienced micropsia and macropsia in conjunction with their seizures. Ultimately, John Todd's research broadened the scope of the mystery entirely. He concluded that the syndrome was, quote, intimately associated with migraine and epilepsy, although not confined to these disorders. The rabbit hole was getting deeper. Soon after Dr. Todd's research, two unique cases of AIWS appeared in the medical world, and they indicated that something else entirely was going on. In 1975, an 18-year-old college student, whom we will call Laura, developed an itchy rash that persisted for over 4 days. She also had a terrible case of pharyngitis, or swelling in the back of her throat. A few weeks later, Laura's symptoms worsened. She lost her appetite, but the most unsettling development was a series of strange visual distortions. Objects appeared distant and out of focus. She felt as if her body would shrink and then suddenly grow to the size of a room. The world, she said, appeared to her as if through a fisheye lens. Laura's physician, suspecting her condition was stress-related, referred her to a psychiatrist. But the psychiatrist could find no signs of psychosis. She was then recommended for an EEG exam to monitor the electrical activity in her brain, on the chance she was suffering from undiagnosed epilepsy. But the EEG came back normal. However, a physical exam did reveal that her spleen and her lymph nodes were enlarged, a clear sign her body was fighting off an infection. So they tested Laura for the Epstein-Barr virus, better known today as mononucleosis, or mono. The results came back positive. Doctors wondered if this common virus could also be the cause of her bizarre syndrome. They treated the mono with antibiotics, and most of her physical symptoms subsided. But her Alice in Wonderland syndrome persisted. For another 9 long months, Laura suffered from changes of color in her visual field, body image hallucinations, and teleopsia. Doctors might have dismissed her case as a medical anomaly, until more patients with mono began displaying the same symptoms. In July of that same year, a 17-year-old girl, whom we'll call Sarah, experienced fatigue, blurred vision, and slight headaches. She didn't feel her own body changing shape, but she reported that objects around her would frequently shrink or expand. She too showed signs of an enlarged spleen and pharyngitis. And she too later tested positive for mono. Just like Laura, her AIWS symptoms persisted for 2 months after she recovered from the virus, with hallucinations occurring 2 or 3 times a week. And then, just as mysteriously as they had started, they disappeared without a trace. These cases spun all the earlier theories about AIWS on their heads. None of these patients had a family history of seizure disorders or migraines. None of them had taken any hallucinogenic drugs. Their condition appeared to be directly tied to the Epstein-Barr virus itself. And yet, doctors couldn't explain why a rare syndrome like AIWS was connected to some of the world's most common medical conditions. There had to be a definitive reason why some patients went spiraling down the rabbit hole while others did not. Let's return to Eleanor, the mother from our earlier story. Her search for answers eventually led her to Dr. Sheena Arora, a neurologist at Stanford. Dr. Arora immediately suspected a genetic component. At her urging, Eleanor questioned her close relatives. She discovered that her 14-year-old son also suffered from the condition, but had been too ashamed to tell anyone. Her sister recalled similar hallucinations in conjunction with migraines as a child. The same went for their brother, who experienced the symptoms during a case of mono. It was clear to Dr. Arora that some sort of genetic link made certain families more prone to the condition. The answer, it seems, lies not in the trigger, but in the brain's response. The majority of AIWS cases are still linked to migraines, specifically during the aura phase. Modern science theorizes that auras are caused by a temporary lack of blood flow to the brain. This disruption confuses the visual cortex, where raw information from the retina is processed. That information is then sent to the parietal lobe, the part of the brain that translates those signals into our conscious perception of the world. A disturbance in blood flow can confuse the brain, resulting in auras or, in more extreme cases, AIWS. But it's not just about what the patient can see. Some people, like the patients of Dr. Lipman, reported a change within themselves, a feeling of growing larger or smaller, or their neck elongating. Doctors believe this too is tied to a lack of blood flow, specifically to the posterior parietal lobe. Aside from translating visual data, this part of the brain is also responsible for how we perceive our own bodies. It generates our internal body image. If this critical part of the brain isn't getting enough blood or oxygen, it can cause a patient to temporarily believe their own body's length and size have radically altered. Alice in Wonderland Syndrome, then, may be a more severe and complex form of a migraine aura, but that still doesn't explain how patients with no history of migraines can acquire the syndrome. The answer may lie in the case of a 21-year-old student we'll call David. In 2008, while studying for his undergrad degree, David began to have recurring episodes. One morning, he felt his feet sinking into the floor with each step. His fingers would seem to stretch out into the distance. Parked cars on the street looked like small toys. Yet, David never complained of a single headache, nor did he have symptoms of mono or epilepsy. His AIWS grew so severe that he became afraid to leave his house. His doctors eventually suggested a fascinating possibility, that David was experiencing silent migraines. This is a known phenomenon where a patient experiences all the symptoms of an aura without the subsequent headache. This could also explain the cases of Dr. Todd's patients, who experienced anxiety in conjunction with their hallucinations. That anxiety may not have been the cause, but another symptom of the silent migraine itself. In fact, it appears that all these varied conditions, migraines, epilepsy, viral infections like mono, are not as different as they seem. They are all linked to similar changes in the brain. Patients with epilepsy report auras preceding their seizures. Both migraines and seizures involve a sudden change in the brain's electrical or chemical activity, which can restrict blood flow. In patients with mono, the AIWS is triggered by a swelling of brain tissue, which again limits blood flow. So, in actuality, it appears that all roads lead to the same destination. As a 2017 paper by neurologists concluded, it seems that any condition that causes a temporary lack of blood flow to the visual pathways and the parietal lobe could potentially lead to Alice in Wonderland Syndrome. Modern neuroimaging technology like SPECT scans have provided the first concrete visual evidence of this, capturing images of decreased blood flow in a patient's brain mid-episode. But while doctors are making progress, there is still so much left to learn, like why the condition, for most people, seems to dissipate on its own over time. The fleeting nature of the symptoms, often lasting only 10 minutes at a time, makes the syndrome incredibly difficult to study and therefore to officially diagnose. Currently, there is no single test that can confirm or rule out AIWS. Doctors now suspect the condition is extremely common, yet largely undiagnosed. The primary reason for this is the deep-seated fear of being labeled with a psychotic disorder. This stigma has severely limited research, and it's why AIWS has yet to be officially included in the DSM, the Diagnostic and Statistical Manual of Mental Disorders. According to the strict definitions of the medical community, the condition doesn't officially exist. This poses a serious problem. In an interview, a woman we'll call Clara expressed her frustration after reaching out to a major psychiatric institute for help, only to be told, quote, "Since this isn't a medically recognized condition, we don't have it listed in any of our databases." They had no way to even locate an expert who could help her. With the condition so underexplored, there is no direct treatment to cure the syndrome itself. Instead, doctors can only recommend treating the underlying trigger, whether that's migraines, mono, or anxiety. Luckily for most, Alice in Wonderland syndrome is a temporary condition. While rare cases persist for years, most patients report that their symptoms fade after a few weeks or months, often disappearing entirely after childhood. In Lewis Carroll's case, he seemed to find a way to channel his neurological nightmare into a timeless fairy tale. But for those living with the frightening and isolating reality of AIWS, it is a trip down the rabbit hole they would rather not take at all. The story of this surreal syndrome is just one file from our archives. There are countless others, each a testament to the enduring mystery of the human mind and the strange paths medicine has walked. If you wish to uncover more of these forgotten stories, subscribe to Medical Obscura and press the notification bell. Join us as we continue to explore the shadows where science and the unexplained collide. We have many more cases to open.